This patient suffered from a disease called Fibrodysplasia Ossificans Progressiva, or FOP. The terrifying disease gradually turns your muscles and connective tissues into bones. This process occurs spontaneously and often begins in early childhood. The extra bone formation leads to restricted movement of the affected joints, eventually causing complete immobility. The condition is also associated with severe pain and increased risk of infections, respiratory complications, and cardiovascular disease. The disease is caused by a mutation in the ACVR1 gene, which produces a protein involved in the regulation of bone growth and development. The mutation causes the protein to become overactive, leading to abnormal bone formation. There is no cure for FOP, and treatment options are limited. Surgery to remove the extra bone can worsen the condition, and radiation therapy is not recommended due to the risk of further bone formation. Physical therapy can help to maintain mobility and prevent complications. Around 800 people worldwide are known to have this rare condition. The walking corpse syndrome is an extremely rare condition that makes sufferers believe they are already dead, non-existent, or decomposing. They may even believe that parts of their body are missing, or they are a ghost or a zombie. This distorted reality is caused by a malfunction in two brain regions, the fusiform gyrus and the amygdala, the areas responsible for self-awareness and perception. Symptoms of the walking corpse syndrome include detachment from reality, loss of recognition of faces, and a tendency to self-harm or deprive oneself of food. This delusional thinking can lead to a lack of motivation, social withdrawal, and difficulty with everyday tasks. Some people with the disorder may even stop eating and drinking, believing that they no longer need sustenance as they are already dead. There is currently no cure for the disease, but treatments involving medication, mood stabilizers, and electroconvulsive therapy (ECT) can help alleviate symptoms. The combination of ECT with medication is reported to be the most effective treatment. Your stomach acidity could affect your feelings and emotions. A study showed that people who experience intense emotions like disgust or fear tend to have lower stomach pH, thus making their stomachs more acidic. But what's causing that? Are the emotions leading to higher acidity, or is it the other way around? To test this idea, scientists asked 31 young men to swallow a smart pill that measured the pH levels in their gut. As the pill made its way through their digestive system, the men watched videos designed to elicit different emotions, from disgust and fear to happiness. After each video, the men rated how intense their emotions were. It turned out that when people watched disturbing or scary videos, their stomach pH became more acidic than the baseline, and the more acidic their stomach was, the more disgusted and anxious they reported feeling. Researchers also found that the breathing rate went up when the subjects felt sad. On the other hand, people who reported feeling happy had a less acidic stomach, regardless of the video they watched. But which comes first, the emotion or the acidity? That's still up for debate. It's possible that negative emotions might actually cause our stomachs to produce more acid. Alternatively, an acidic stomach might be responsible for intensifying our emotions. The researchers plan to give participants proton pump inhibitors, which reduce the amount of acid produced by the stomach, and see if this affects the intensity of their emotions. They're also exploring other ways to measure the relationship between our gut and emotions, from gas composition to chemical concentrations. So, the next time you're feeling queasy or anxious, remember that your gut might be trying to tell you something important.